Hi everyone, so my name is Natalie and today we're going to be talking about MDMA. So in terms of topics for how this infomercial will flow, first we're going to talk about background information and then we're going to talk about short-term and long-term effects, followed by risks and consequences, and finally concluding with current research. So background information for MDMA. So the drug is commonly known as Molly or ecstasy, and it's a synthetic drug that alters mood or perception of the things around them. So originally, MDMA was synthesized in 1912 by the drug company Merrick. However, the psychoactive effects and long-term and short-term risks associated with MDMA were not discovered until 1976. Before MDMA was used recreationally and labeled as a Schedule I narcotic, it was used in a clinical setting. So MDMA can be taken in pill form. An individual has the option of breaking open the pill and either snorting it or taking it down as a liquid if they empty the contents of pill or crush it into a water bottle. So it could be a pure capsule or pure powder in a capsule, or it could be in a pressed pill form. And this invites the risk of MDMA not being pure and then being cut with other substances that can lead to serious damage to your health. So before MDMA was used for recreational purposes, MDMA was used in a clinical setting in psychotherapy by therapists. However, it in recent decades has been used in the nightclub or rave scene. It was used by the younger adult population, but now it is being abused at a larger scale in the recreational use. So MDMA, people who take it will experience short-term effects and long-term effects. So a typical dose of MDMA is about 85 to 125 milligrams, and it lasts for 3 to 6 hours. However, there is a trend to, once the effects wear off, to take a second dosage. So short-term effects include pupil dilation, euphoria, open-mindedness, and being unafraid. So MDMA will cause people to feel very open, very loving. Increased levels of dopamine, norepinephrine, and serotonin. Nausea, muscle cramping, involuntary teeth clenching, blurred vision, chills, and sweating. So long-term effects of MDMA are still being studied. It is a controversial topic because there are benefits that are noted of MDMA, which we'll further discuss. However, effects using MDMA can include heat stroke. So when using it persistently, even through the night or over time, you are at risk for heat stroke. MDMA affects the hypothalamus, which is the part of the brain that helps us regulate our body temperature. And a lot of the time, people who use MDMA report overexertion. And thus they're sweating, they're really hot, and then they're also not hydrating. So there is that risk for heat stroke. And because people are aware of the fact of dehydration, people overcompensate their drinking of water, and then water is heavily retained by the body due to MDMA, and that can also be fatal. As a result, overdose is also a risk, not only because of taking too much MDMA, but also the risk of taking pills that are cut with other substances other than the pure drug. Risks and consequences of MDMA include added drugs like we discussed, so the fact that it could be cut with various things. Unsafe sexual behavior if someone is under the influence, including not only MDMA but other substances, they are at risk for engaging in unsafe behaviors that may lead to unprotected sex. There is also addiction as a risk, and of course death due to overdose. So current research is saying that MDMA may have beneficial effects. So as discussed before, it was used for psychotherapy, and it is still labeled as a Schedule I narcotic, but now MDMA is being studied worldwide in therapy to treat people with PTSD and anxiety. 2/3 of patients studied did report that the MDMA did help them because they did not meet the criteria for PTSD 2 months after the study was conducted where they did use MDMA. And with these studies, researchers are hoping for FDA approval of MDMA by 2021 in regards to clinical use. and that's MDMA.